No, to tell me, give me, I'd like to know, when your girls were growing up and you took them to school, did you explain to the teacher their condition, for example, or did you not? Um, if the teachers were aware, or if the administration were aware of it, of your children's condition, were they, was there a stigma, or were they just being treated as equally? Are there reports that they once told you that this and this happened in school and I'm not happy about it? You explain that to us.
Okay, thank you, Ademo, very much. Yeah, when I took them to school, especially in the early childhood days, I explained to their teachers that if you see anything strange, call me. And always I was making sure that my number is left in school. So reaching primary, in nursery they could not talk about it, they were still young. But reaching primary, maybe in upper classes, now they could come home with the messages. Mommy, why is teacher telling me not to sit the class as others? Then I was to explain. Then by those days, I was not having counseling background, but my girl's life forced me to do counseling. Not forced me, but with passion. Now I say that I must be a counselor to help them go through. So, Serenity, they were going to different primary schools. So, Frenzy, the first girl, was going to a private school, so those people were understanding. But Serenity was going to public school, where someone could tell her that you will die. And she was like, Mommy, they are saying I'll die. So reaching Form 1, when Frenzy, my first daughter, joined Form 1, she was going on a lot of crises. So even when I was at the work, I could run to school. So one day, the principal of a school called me while I was at work. Are you Mama Frenzy? Then I said yes. If your girl will become sick again, I will chase out of the school. Then I busted. I found myself, I busted. I was asking her, is that the only school which can make my child to achieve, even to be a president of a nation? Go ahead, do it. And I will follow the case with you. Because I think my girl did not apply for this disease. Even herself, she's not happy with it. So by that time, matron of the school took the phone and talked to me. Mama Frenzy, just calm down, I know the teacher. But, and remember, this is the school where my girl, in fact, she went with them like that. But later, I went to the school and explained to the headmistress again that this girl has this condition, but not because she loves it. It is something that even if you explain for her, she cannot bring it out of herself. So they were facing very difficult moments sometime in school. I know maybe the question will come, but when Serenity was about to die, Dr. Leah was our immediate doctor. She was helping a lot. I think Seren told her that she's afraid of death, and people are saying that she will die because the sister also passed away. But I'm thinking it is not something good to make a sick warrior know that she will die. Just the way Leah was saying. Don't tell them. Don't give them time. Just encourage them in life just like others. But people are careless in our communities. They don't know how to give them information. When my first daughter died, is when Serenity heard others saying that this one also will die. And only 8 months she died. So I think the information also is very powerful to our sick class. They can't contain them.
Wow, thank you for that. One of the things that I think we need to talk about, maybe from you, Dr. even Leah and Lot will give us. What are some of the pointers that can actually now prompt someone? Let's assume that, I know right now the government has been trying to, to put parameters where a child can be screened. I know in other countries children can be screened in utero. I know right now, there are parameters that have been put so that immediately a child is born, just the way they check the APGAR score is the way they can do an immediate kind of screening, so that we know whether our children have the trait or they have the disease. I'd like to know, what are the, especially for people who may be having children and they're not aware, because we have situations whereby we have children, we're not aware that they have sickle cell, but maybe what are the easy to tell symptoms that can actually now prompt someone? If you see 1, 2, 3, 4, you see these three, can you go to the nearest hospital and request for this kind of test? So please take us through that. And I know, of course, she already talked about what a child went through. There was arthritis, yet it wasn't arthritis, and the baby was put on arthritis medication, and it turned out that wasn't basically it. And I like Naomi. Why? Because Naomi maybe remembers certain things, or maybe she's able to relate. You could tell me if you have a stomachache that behaves like this, because she's able to describe. You and I can do that in theory, or you and I can do that in theory, yet she's the practical. Yeah, so please tell us the indicators of what a parent or a caregiver who has a child who's probably has a series of infections, and I know the simple things that can truly tell. I know you can almost look at someone right now and then you say, you need, if I'm lying, you tell me. You can look at someone and then say, you need to go for this screening. You need to go for this screening as a professional. So please explain how that can be done.
Okay. Yeah. So, signs and symptoms of sickle cell disease. Number one, that is very common, is the swelling of the joints. They swell, including the small joints. We get swelling of the joints, swelling of your feet. This is basically because the sickle red blood cell has clogged around that area. So it clogs and clogs some more. And now we end up like when you keep pumping air into a balloon, there's a limit where it can stretch. So this is what happens. Our sickle red blood cells clog and now they cause swelling. So the number one sign that is confused to everything is the swelling of the joints. We confuse it to kwashiorkor. We've had babies being treated for kwashiorkor and it was sickle cell because they are swollen. Then we've had babies like the baby to Mama Serenity who's being treated for arthritis because sickle cell did not come out so clearly to them. So the number two symptom is the paper white. You've had in both cases, they've been talking about your baby appearing white in color, your baby having a brownness that looks not so brown, it looks yellow, that is jaundice. Then your child, there are children who have a bossing of the skull. Bossing of the skull basically means your forehead is a bit it's a bit protruded.
Right.
No.
It is so like a bus-like board.
Uh-huh.
People are even telling them that your head looks like a bus.
Yeah. Now that your head looks like a bus is called bossing of the skull. How does it come about? Your body has to develop a mechanism of making blood, so it will go including to your medullary to look for blood, including your very small bones. So in the process, it makes you have the bus-like head, like they've said. Then there are kids who, you wake up in the morning, the kids are around 2 years, 5 years, they are always having an erection. There's that early morning erection, especially to our boy child. There's the early morning erection. But in this case, we are having an involuntary erection. It is very painful. It's called priapism. Then we also have kids who present with something called acute chest syndrome. Acute chest syndrome is like the red blood cells have clogged into your lung, your blood supply to your lungs. So you get difficulty in breathing, coughing continuously, severe chest pain. Then we also have stroke. We have these red blood cells, they go and clog into your brain. And now you don't have oxygen supply to your brain. There are kids who just present with stroke. Then there are also kids who present with bone deformity. You're wondering, there's just something that is eating onto your bones. We call it the necrotizing head of femur. It has eaten into your bone. It even changes your walking stature. Then there are some people who just present with the skin. You just have a weird skin condition that you've tried everything and it surely doesn't go away. In case you have those and any other, there are people who also present with an abdominal swelling. You hear, ule mtoto yake, tumbo yake ni kubwa. It's usually the spleen. The spleen is what enlarges because it's overworking to have to keep breaking down the red blood cells after every 20 days. So that's where the broken red blood cells are stored. So you find that in some people, you'll have the swelling of the abdomen. Then what we can do is just to know our genotype. Because carriers of the sickle cell trait do not show any signs and symptoms. So like before we get married, now we are having the genotyping going on. You can know your genotype. What is your sickle cell status? Then maybe you make a decision from there. So before you do your HIV, you know your blood group, we would request you also add your genotype in the screening test that you do before you get married.
Thank you very much. So Naomi will also take us through the pointers, the signs of the things that she's gone through. That makes it a little bit unique because there are people who get lucky not to be diagnosed and they don't have any other symptom until a later stage. And they don't know. You've said somebody presenting with a rare skin condition. Maybe the person doesn't get sick and the only person they have is maybe that one. So maybe she can also take us through, certain symptoms that you feel because you are that person. You know better than I do, than what I can read, than what the doctor's experience she knows, and then than what a caregiver knows. You know the kind of shoe you're wearing, we cannot fit all of us. Yeah. So this, yeah.
For most warriors, at an early age, most of them you can't notice unless they present with what the carriers say. But if they don't present with that, maybe the HB, the low HB, but most cases doctors assume it's severe anemia. So you'll just be transfused. But for adult warriors, we always know ourselves. Like in my case, I know when I'm going into crisis, I know what triggers it.
What triggers crisis? I'm interested. It's funny how you're always bubbly, you laugh. The other time you called me and told me, I'm in pain. I'm like, where did that strength come from? The only thing that could actually tell me that was your voice, because I know your voice. To me, I'm in pain. So what triggers your crisis? It would be very important to know so that we help any other person who maybe has not come out in the open, who's not courageous enough and as brave as you are to talk about certain things.
Okay.
Yeah.
For me, apart from infection, it's happiness.
No way. No.
When I'm excited, I tend to go into crisis. And then if I overwork myself, I go into crisis.
Oh my goodness. Are you kidding me? Oh my god. Okay, that's wow. Okay, fine. I didn't know that.
Okay, I'm that smiling person, but I limit. my happiness.
So I shouldn't make you happy.
You should. You should.
Oh,
Mm-hmm.
very interesting. Note, just briefly tell me, are there things that you, of course, now you went through with what you went with frenzy and then serenity, you saw this, the symptoms were a bit different. Is there any other thing that you can actually tell a caregiver? If you see this, please make sure that you go for this test. And then I would like Dr. to tell us the name of the test that we need to go for, especially if we've not gone for screening. Now that we have the 19th of June coming, the World Sickle Cell Day, what kind of screening? The name. We want to know the name and where it can be done, especially even in Kisumu or even in Nairobi, Mombasa, for anybody who's watching. And so, Note, please tell us, what are some of the things that you can tell a caregiver to look out for?
Okay. Thank you. Thank you very much. There are some symptoms which you, as a caregiver, you must be very, very cautious with if you see them. Maybe in the morning when a child wakes up and she's telling you she has pain, don't take it for granted. And maybe let me talk about the pain before maybe you know that your child has the sickle cell disease. Maybe when your child is just normal, and after that you are seeing your child is now growing thin, the color is changing, just the way we said. There are some maybe swelling hands, swelling legs, and the child can cry abnormally. Like I can say one day when things were starting for Serenity, she cried, but I forgot that I have another sickle until she could not put on clothes. She wanted me to remove all clothes. So I was like, is this a devil or what? I was like that. Shetani ama hili. Nilisahau kabisa. I forgot. I did not even think that I have another sickle. So I went to the hospital. That is the time Seren was diagnosed with sickle cell. So there are some things which a child must be doing like that, or like what I've just talked about. As a caregiver, you must be very cautious and you should not even wait. Anything that you see in a child that is strange, don't wait. Just rush to the hospital and there you will know what is happening. But you will find in our community, there are some sicklers who are really suffering. The parents are not aware. The parents are just there with what they know. They can tell you, people are saying that my child has a blood problem. You see this. And have you even tried to take the child to see, at least to see the doctor or to consult the doctor? Then she's like, I'm used to that. So here, even I'm seeing mobilization should be done. Maybe house to house. So these people can be told what to do, the signs and everything. If they see this, let them rush to hospital and see what is happening. Yeah. And you can find that that with me, maybe I'm a bit enlightened. I know what is happening, but there are some caregivers who know. They are just ignorant. They don't know what is happening. So this will call again you people, doctors, everyone, just to come out and do mobilization and tell these people what is happening. So these sicklers can get early diagnosis and be put on treatment. Yeah.
So, Dr. tell us, what is the name of the test that people need to go for? I'm saying this for the sake of somebody who possibly is doubting, maybe has seen all the listed symptoms that are there and they possess them. So if they walk into hospital, what kind of test should they ask for? What's the name of the test that they need to do?
Okay, thank you. So the first test we do is called a full hemogram. A full hemogram will be able to tell us how is your HB, how is the state of your red blood cells. Then after that, you should also do a sickling test. A sickling test, your blood is subjected to 24-hour investigation. We are able to pick up from the red blood cells. What is the shape of your red blood cell? How does your red blood cell look like? Then if it's inconclusive, if it's positive, or if it's inconclusive, we need to move to a test called HB electrophoresis. With HB electrophoresis, we now know what is the hemoglobin gene. Which one do we have? Because we have like 4 types of sickle cell genes. We have the HBSS, we have the HBSC, we have the fetal hemoglobin. Fetal hemoglobin is very unique. That's why in most cases, we could not be able to diagnose children below 2 years for sickle cell disease, because they have this fetal hemoglobin that protects the red blood cell from sickling. It has a way in which it protects the red blood cell from sickling, but it weans off from 2 years of age. Then, basically that. Once you do the HB electrophoresis, you're able to know what type of HB do you have. What is your sickle cell status? Are you a trait, or are you an SS or an SC or a beta thalassemia? So that, because they have different presentations and their severity is also different.
Okay.
Yeah.
Thank you very much for that. So we've talked about the symptoms. We've talked about what to look out for, the kind of tests, the indicators. Now, I am actually keen to know how caregivers can help and teachers have said about how we can help our children avoiding stress, avoiding conflicts at home as much as we can. You've mentioned generally, I just like to know what are some of the things we can do for caregivers apart from I'm a believer of making sure that caregivers are 100% okay, and of course there's a thin line between a caregiver accepting diagnosis and not accepting and ensuring that the well-being of a child who has tested positive for sickle cell is given maximum and maximum care. So how can we help? Do you think support groups help? What is the role of advocacy groups, for example? And I know most of us here, we are here as a result, even as a result of being an advocate of something, for example. Very few of us are going to celebrate on 19th June, which is a World Sickle Cell Day. And for me, this is huge because we get to create awareness and just let people know that, you know what, sickle cell is here with us. Of course, we are advocating for zero sickle cell. That's why you're talking about gene counseling or knowing your genome, for example, so that if you know you have the trait, then you know both of you cannot come together. And you talk about the mates while you're answering, because people say, mwanaume anasema, sana sana wanaume ndio usema, that one is not from me. And then we end up seeing single parents. Or if you get a tough woman will tell you, hapa si kwetu. A tough woman will also leave the kid. I know we've seen those cases. We've seen women also running away from the children. We've seen fathers running away from the children. So if you can't tackle the mate, because you tackle the other one, which is the death date. So there's the aspect of where does it come from? I mean, is it from both parents or is it from one parent? We need to keep repeating that so that we understand, because we think we know. So tackle that for me. I'll be very happy.
Okay. Thank you. So, where does sickle cell come from? I think that we would have handled like the second bulletin after introduction. So, how do our babies get sickle cell? Our babies get sickle cell because we said from the definition that sickle cell is inherited. It's inherited to mean that it does not come from anywhere. It comes from both the father and the mother. And this has to come out very clearly. Everybody has 2 hemoglobin genes. It's either A and A, or A and S, or S and S. Those are the 3 major hemoglobin genes that we have. So when we talk of inherited, it means the mother has A and S. meaning the mother has sickle cell traits. Then the father also has A and S, meaning the father also has sickle cell traits. They will not show any symptoms. They will be very okay because of the presence of the A. The A is the normal hemoglobin gene. So this A will struggle to protect the sister S, who's now sick down here. So in the process, when now we are having our firstborn child, now we are both carriers for the sickle cell trait. We are having our firstborn child. So when the father gives this baby A, I give this baby A, and we are both AS, it means we have a 25% chance in every pregnancy to give birth to a child who does not have any traits of sickle cell disease. This 25% chance is not determined in any order. It can be your firstborn, it can be your 10th born. Then now, our baby number 2. The mother gives an A, the father gives an S. We are going to give birth to a child who looks like us, who has the sickle cell trait. Will not show any signs of sickle cell, because now you will have 50% chance in every pregnancy to carry a child who has sickle cell trait, is not active for sickle cell disease. But now, when the rubber meets the road, the father gives an S, the mother gives an S. We have a 25% chance in every pregnancy to carry a child who does not have any normal red blood cell. And that is what we call our sickle cell warriors. So it does not follow any order. And it does not come from anywhere. It comes from the father and the mother to this child. Yeah.
So that means every pregnancy becomes a risk, kind of quoting.
Yes.
Yeah. Okay.
For every pregnancy, you have a 25% risk of having a child with complete sickle cell. You have 50% chance of giving birth to children who look like the two of you, who are carriers. Then you have a 25% chance of giving birth to a child who does not even have any S in their system.
Nothing at all.
AA.
Absolutely.
Yeah.
I think that's very clear, because that's some of the myths that would really like to break and just, and tell guys, you know what, it takes 2 people for a child to get sickle cell. And I think it would also be important to let the child know that it's out of not knowing that we assumed, and 2 people came together, and so that we don't send a caregiver into a mode of depression. It's my fault, maybe be suffering, so now it's my fault. And ideally, I think that's also a role that we also have to play as people who are trying to make a difference in the society, whether as a medical practitioner or whether as an advocate, as Naomi is, or even as you. You mentioned you went back to school so that to study, to do counseling, right? To help your children cope. I truly have to congratulate you, and I'm going to ask for a hug after this. And then I remember Naomi also said that her mom went back to school. So when did your mom go back to school?
After I was very sick, now she was like, this disease, I shouldn't understand it. So she went back and did nursing.
Wow. Look at that. I mean, those are nice things to hear, because I like saying, in our brokenness, we all find purpose. You found a purpose to do counseling, to help people cope, to help your children cope and go through. Your mom decided to go into nursing to help you grow, and look at you. Please invite me for your next birthday. I want to cut that cake for you. And it would be interesting to know, we've talked about how we can help our caregivers, how we can also guide our teachers to be nice to our children. Do we have like a guideline? What are the kind of, for example, are there vaccinations that are, kind of reserved for people who live with ACD, for example, for children, that can make life bearable? Remember, you've mentioned they're at risk of getting a stroke. Of course, infections we have. I know flu really takes them down. Do we have flu shots? Do we have pneumonia shots? Is this something that we can do? And then I know there's been a lot of research and saying that at least we have a cure for sickle cell, which is bone marrow transplant. right? The only one so far. And then, of course, there's the gene therapy that is coming through. But Daktari, I want you to tell us maybe if there are vaccines that can truly help these children or just to make life bearable for them. And if they're there, where are they found, for example? And are they important at this point? Yeah, so please take us through.
Okay. So because our red blood cell is also a favorite to malaria, so we need to ensure our babies get the malaria vaccine. It is very good that now we have the malaria vaccine. Ensure our babies get this malaria vaccine to protect the red blood cell that is already it's what do we call it? The red blood cell is already a favorite to the malaria parasite. So when we ensure that they get this vaccine, then influenza is a viral infection. As you can see, a component of our blood is having issues. So we need to protect them from anything that would make them go into a crisis because of infection. Like currently, what we have in the air is influenza. It is not a walk in the park. But when they are vaccinated, it helps them. Then we also have the pneumococcal vaccine. Like we talked in the signs and symptoms of sickle cell, we had the acute chest syndrome that in most cases is diagnosed as pneumonia, where we have our children are not breathing, the severe chest pain, we have to have them put in oxygen. So the pneumococcal vaccine also comes in very handy. Then we have the meningococcal vaccine. The meningococcal vaccine is supposed to help us. We are predisposed to stroke. And meninges, our meninges are also are not safe because we easily go into meningitis. So the meningococcal vaccine is also here to help us so that it protects us from the stroke. It also protects us from going into infection of the meninges. Yeah.
Okay. Thank you for that, because I think you've heard about vaccines. If your child is not vaccinated, I know those are booster vaccines, I think. Yeah. Please, let's ensure that our children get booster vaccines. And we will be discussing more. I'll be consulting her a lot of times so that if I come back on the show and I say, by the way, we need to do 1, 2, 3, 4 because it's very, very important. If at all there'll be any new vaccine that comes on board for the sake of our sickle cell warriors, then I would like all of us to be enlightened. And I think they've truly encouraged me, and we need to do more. And as we say, the month of June is a month where we, especially on the 19th, is a day designated all over the world to celebrate sickle cell, to create awareness of sickle cell. So this month, we're going to be talking more about sickle cell, especially from the caregivers, what counselors are saying, how are we failing as a society, how are we failing our children, how are we failing our medics.